CSR jong company star simen Lumshnong min ha si sa jan ka prathrik julio arjapsan kalapalong yak program cancer awareness but ka cancer screen cam Lumshnong community hall East Yandel district ha ka bagi doctor ki bana North East Cancer Hospital and Research Institute Jorabat Assam kilawan man panya yak ni kas awareness but le yak screening check up but kiladan hadu aspa arpaingot ki nongsong shnong ki bana Lumshnong but na preacher non ki bala one shakani ka screening cam Habakran shiki patay ko bor badru kum kajing pensya shiki padpa akabede bad kajing pang cancer nakalyang u Dr. MN Barua ubade u Dr. Bahe jong North East Cancer Hospital and Research Institute Jorabat Assam ulong ba rada shukshem kulum nakashispa ngot kiba pang cancer arpangot kidai tang nakajala Meghalaya kiba Juwan Sumar a North East Cancer Hospital and Research Institute Jorabat manaus nambat halor kani ula ong balesi kani kala bandai nakadaw ka jingtuna ki awareness program bat kiba pang cancer kipa schedule ka stage 4 ni last stage ula ong ro baka jingpang cancer ka jalay bha hakathan shatay lamingi kum Meghalaya bat Assam kadaw ko day nakarukam pam rukam di kum kapapam kwai pam tuma kabadi sikran pat kabadi kyan Dungin ngap shushu ikajing pensya nu Dr. MN Barua bat kum juru no medical officer jang star simen Lumshnong u Dr. Sanjeev Deka kibala don lang hakani ka screening camp program ki kentup ru senior general manager jang star simen ubade ru retired air marshal Indian Air Force URV Ramkishore lembat u Dr. Rahul Das Dr. Anukampa Barua Kibana North East Cancer Hospital Jorabat Hospital lembat u Dr. N. Pynlong bana Lumshnong PHC.
If you see out of 100 patients in cancer literature in this part of the country 35 cancer is because of tobacco out of 100. And near about 20 cancer is because of alcohol and another 15% is because of our food habit and another percentage is because of infection. Even SIV also causes cancer. When there is depression of the immune system because of SIV and AIDS, patient may have Kaposi's sarcoma. So many cancers are there related with SIV. Even cervical cancers are more common in SIV patient. And if you see 35% of the tobacco out of 100 cancer patients, near about 20% because of your alcohol, 15% because of infection. If you add this list, near about 75% cancer is preventable. If you stop alcohol, if you stop tobacco, if you stop your bad habit like taking betel nut and all, it will 75% cancer is preventable. One important thing is that entire world is suffering in this disease. So many researches are going on, but there is no breakthrough till today. Because many times we don't know the cause, but when we know the cause, we should prevent it. There is a saying like that: the wisdom of the society comes later than the science which have developed the knowledge. In 1951, the British medical journal said that tobacco causes cancer. So that knowledge, we are yet to be converted to the wisdom last 75 years. Still we are taking betel nut, still we are taking alcohol, still we are taking tobacco. So society's wisdom is required to control the cancer. And every village should be included actually. And maybe I can request them, at least 70 to 80 villages should be screened for cancer, mainly oral cavity cancer, breast cancer, and that should be repeated after 1 year again. Because suppose today I have seen cancer does not occur in a single day, it takes a long time. So for say oral cavity cancers because of tobacco and betel nut, it takes near about 20 years. So if we can advise the patient, make them aware that these are the possible cause, you stop it. And many people have changes already. I have seen today few patients already, they have already changed. That changes is not cancer, But this cancer, these changes called leukoplakia, some white pads and red pads, can be converted to cancer in future. So if they stop this offending agent, then maybe within 5 or 6 years, this will go down. I will tell you one thing, that you cannot reduce the incidence of the cancer by curing it. If you really want to reduce, you have to prevent it. Prevention is better than cure. Everybody knows. So cancer cannot be, incidence of cancer cannot be decreased by curing it. You have to decrease by preventing it. And another big challenge here in Northeast, we have, say, stage 1, stage 2, stage 3 and stage 4. Now in stage 1, suppose one tumor is less than 2 centimeter. Stage 2 is 2 to 4 centimeter. Stage 3 is more than 4 centimeter, 6 centimeter. And stage 4 means when it involves the bone, when it involves the skins. Now, unfortunately, stage 1 and stage 2 cancer patients are very few in this part of the country. 85% of the cancer patients in this country come in stage 3 and stage 4, where there is no satisfactory treatment. But only 15% were getting in stage 1 and stage 2. So that's why awareness, early detection and screening is very important, and I'm really thankful to them that they have organized such a big camp to screen the population.
Well, the northeastern people have got higher incidence of cancers if you compare it with rest of the country. The major factor for contributing the higher incidence of cancer in northeastern people is because of their dietary habits and also their main habit of chewing tobacco as well as bitter nuts. To prevent cancers, we have to educate our people, especially our village people, to avoid chewing tobacco and bitter nuts, which are one of the main factors of having oral cancers as well as lung and stomach cancers. With that objective in our mind, the Star Cement CSR department has been organizing a lot of health camps and health awareness sessions in and around Lumshnong village for last several years, wherein we have been inviting people, health experts and specialists from Guwahati also. Not only that, we are also distributing free medicines during the health camps. Thank you.